Welcome, one and all, to Liberty After Dark live stream. We hope that you enjoy the show and will engage in the conversation along with us. So, without further ado, here's your host, Christian Moore.
There we go. What is up, ladies and gentlemen? My name is Christian. Welcome to Liberty After Dark. That's much better. So we're here. It's episode 29. We got big, cool things going on, so I hope you guys want to stick around for that and enjoy it. It's gonna be a bit different. So I'm gonna try to do this in a way that I think is more educational than a typical episode of Liberty After Dark. Without coming off in any sort of way that would be outside of the show. So we're here, but also doing the bedtime routine. Oh yeah, you guys are good. So we're going to do news. Not really much I want to talk about. Actually, there's only one thing I really want to talk about. There's the impeachment stuff's going on. Whatever, guys. We talked about this before. I could really care less about all the impeachment stuff. It's the Senate jurors have all been sworn in, and the case is going to be probably about a month long, and then they'll find him. They won't come to any sort of damning conclusion, even if they did come up with something. So, have you heard any of my epic songs? I'm sorry, Ninja Cat, I haven't. I've been pretty busy this last week. I haven't even been able to edit the episode with LLN that we did last week. I'm gonna try to get that out this week, though. I've been behind, so first week of school, so everything's kind of getting used to the new cycles. But I've got Monday off, and speaking of that, this is the one news item I really wanted to talk about, and I didn't do my introduction. So how about we we got 6 people here, whatever, we'll just get this ball rolling. Welcome, ladies and gentlemen, to Liberty After Dark, episode 29, Healthcare 101. So if you're listening to this in the podcast, we actually just went over one piece of news real quick. That's the impeachment stuff, how the impeachment got moved into the Senate. So they've selected jurors since the last episode. If you've listened to the show before, you know I don't really care. Moving on from there, the actual news I wanted to talk about. If you were listening to this live, then on Monday, 2 days from now, in Richmond, Virginia, they're hosting a pro-Second Amendment rally. It's definitely drawing a lot of buzz. I don't want to make any sort of unfounded claims about it, but it is definitely interesting for sure. I will be keeping eyes on it. I will be watching to see what happens. Virginia is, they're very paranoid, particularly after what happened in Charlottesville, of any sort of potentially right-wing leaning, which this would count as that event going on, to try to mitigate the amount of damage. But at the same time, I think they're taking steps that obviously I don't agree with. Not only do I not agree with them existing, the whole banning of the weapons thing is kind of insane. And it was just recently, this just broke not too long ago, a few hours ago, the Virginia Supreme Court reaffirmed the decision of the governor. So his executive privilege and his state of emergency are being honored by the Supreme Court of Virginia. However, that doesn't make it right. Okay, so just because a bunch of people, even experts, say something is true doesn't mean it's true if you can demonstrate otherwise. So it doesn't make them right just because they're in the Supreme Court and they said it. They're normal people just like everybody else who have their own set of biases. So whatever. We'll move on from that. I suggest that if you have some free time, keep an eye on Twitter, Facebook, or someone's going to be live streaming it. Just keep an eye on it. I think it'll be interesting. Hopefully nothing happens, and hopefully people just get to express their Second Amendment rights, but we'll see. That's all I'm saying. We'll see. I hope that's what happens. I really do. Cool. I don't have anything else. Ninja Cat wants to know, what song parody should I do next? You should do I Want It That Way, but in the style of that Mongolian metal band that does like the throat singing. That's what you should do. I think that would be a good parody song. Okay, let me go ahead and set this up. I gotta move this to here. And then I gotta click on that. Wait. Why isn't it? Wait. There it goes. Boom. Money. Except for I gotta make this smaller. Oh geez. Cool. And then I gotta move this over a little bit. I had this all planned out. But that's how it goes every time. I have everything planned out and then nothing works. So you do Minecraft parodies. See, that's pretty interesting. Is the size of this all right? Can everybody see everything? It's all working, right? Let me get this guy kind of over here. Yeah. There's like a white box there. Can you guys see that? I don't think you can. I think that's just me. Cool. Oh, I see what it is. All right, we're going to get rid of that. Don't click the wrong spot. That's how you get Pregante. Yes. Check out some of my songs. We'll have to do that. Ninja Cat, we'll have to do that. Okay. Can everybody see this all right? That's my biggest thing. So if you're in the podcast, I'm going to be pretty much saying everything I write down, but you're really missing out because today we got visual aids. And for those of you who aren't a part of the Facebook community group, we hosted a vote, a poll out there because I like polls. And I wanted to see what you guys wanted to talk about because we had a discussion on the show about healthcare, but it was really brief. It was really kind of, topic was brought up and then we kind of had to move on because we had other things we were going to talk about that day. But, it really sparked a lot of interest. And so I definitely wanted to come back to it. And I gave myself, instead of the normal, like usually I'll come up with a topic, I'll do like a week's worth of research. Usually I do an hour or two a day at most. And then I'll really, the day before or the day of, I'll really like grind out some sources and stuff like that. So I kind of did the opposite today. I've been doing a lot of research the last 2 weeks. I had the LLN interview last week, which was a lot of fun and great. I'm super glad that we did it. But I gave myself a little bit of extra time for this because I knew this was going to be a doozy of a topic. And for those of you who are not technologically literate, we can write things. Look at that. Isn't that fun? So you guys will get to see my terrible handwriting sometimes, and I'll underline, and sometimes I will highlight words that I think are important, but you won't be seeing that one much. But I'd like to use stuff like this more in the future because I feel like this kind of interactive, I don't want to be like PowerPoint slides. This is honestly more words than I like having on something like that. But I feel like having visual aids to go along with the things that we're talking about can make them less boring as hell to talk about. So, unless anybody's got anything before we go, we can go ahead and jump right in. I'm going to try to make this as educational as possible while maintaining a discussion and also while not being super boring. So this is going to be a good challenge for me. So I jokingly, I called this he says, teach Alan how to write on the screen. Actually, I use this little pad here before we get started. I guess I'll go ahead and explain that. I use this. It's like a little drawing tablet, and I use this little pen here. And so what that does, and this thing is super good. So it's like no palm, like I can touch it with my hand. It doesn't do anything. But the second I pull out the pen, I can go ahead and start writing nonsense. Which, man, writing something and saying another word is actually kind of difficult. So now you get to see how I do all of my weird words. Like I do my P's, or I think it's sixes. Oh, no, that's not sixes. Whatever, I do weird letters and people... Oh, P's? Yeah, I do P's from the bottom. So you get to see all that kind of stuff. Yeah, so welcome to Liberty After Dark 101. Today we're going to be going over healthcare. We're going to be doing kind of a skim over the whole topic because when I was doing some research on this, I really just kind of wanted to get straight into it. Like, okay, let's talk about healthcare being broken and blah, blah, blah. But for something to be broken, it had to be functional to begin with, right? So that was, my dog is at the door, excuse me. Hello, buddy. So, like I said, for something to be broken, it has to be functional to begin with. So at some point, United States healthcare was quote unquote functional. Okay. We'll get more into that in the future. But so I wanted to kind of just jump in and just talk about contemporary healthcare, but I think it would do us a lot of good to just quickly go over some of the big points of healthcare. And I have some visuals. If you don't, I'm not going to drone too long about it. I just want to hit on some of the big things. And then I have some charts and some graphs, and we're going to talk. And most of the stuff we have on screen today is just going to be charts and graphics to help us contextualize what we're talking about. So a couple of interesting things, or not so much interesting, but a couple of things that are going to come up that aren't necessarily directly related to healthcare. We're going to be talking about ethics, everybody's favorite. Everybody's favorite little ethics is going to come up all throughout this entire topic. We're also going to be talking a little bit about economics, and my E's are looking terrible today, but the more I do this, the better I'll get with practice. And we're also going to be talking just a little bit about foreign policy, and I spelt that wrong, so we're just going to call it FP for short. We're going to be talking a little bit about some FP. And the reason that these guys come into topic is because ethics, well, as we all know, I mean, ethics are going to be, when we get to the point where we start talking about like what solutions to this problem are, ethics right here is going to be what takes us to the solutions that we have. Economics is, we're really just going to be talking about possible solutions that are being proposed in the moment and how valid those solutions are. Hello, Trip. And foreign policy is just to contextualize a little bit how our standing is with other countries in relation to this stuff. So, yeah, we've got it right here. We'll use this fun color. History of healthcare in the U.S. Easy stuff. When healthcare became unaffordable. That's really the same thing. I should have made those the same point. Analysis of current attempts to solve the issue. Practical solutions. These are not the same thing. Impractical solutions. Also not the same thing. And then we'll just go over everything that we talked about. And then, yeah, we'll be good. So first things first. This is not where this is supposed to be. So all of them are probably going to start from the bottom. Let's talk about healthcare. Before we even get into the history, real quick, what is healthcare? What is it? Is it medicine? Is it hospitals? Is it pills? Is it aromatherapies? Is it treatments? What is healthcare? And so the real answer, which we'll just go ahead and scroll down, and we're going to use a couple different sources here. Some of these you guys may not quite like, but the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if we take that definition of health, which I think is a fair definition. Okay, it's a little modern, perhaps, but I think it's a fair definition of health. And then we add what does it mean to care? Health care is the accommodation of anybody who doesn't meet this criteria to get to this criteria, right? So again, but like what does that mean? So it covers all of those things we just talked about. It covers everything from going to the shrink. It covers pharmaceuticals. It covers getting your kidney transplanted. It covers all sorts of different addiction, pretty much everything that has to do with, again, your physical, mental, and social, whatever, but physical, mental well-being for sure are definitely a part of your health. So let's talk a little about the history of healthcare. So this is kind of starting off in an interesting place. This is a very sparse graphic. It's from the American Institute of CPAs. This is a timeline of healthcare reform in the United States. So if we start even back before this, if we start over here, right, in this area, healthcare in the United States kind of looked like, in its dawning age, healthcare in the United States was you either pay for the procedure or you don't get the procedure done. There were philanthropic people, obviously. Mary Seacole is a good example of someone who was in medicine who, in a time when healthcare was was not something that everybody had insurance for and just got. Was someone who helped the disenfranchised to get health care. But really, in the United States, by the time that we're talking about really post-Civil War era onwards, that was really the beginning of the time where philanthropic adventures were like most hospitals were nonprofits. Actually, pretty much all of them were nonprofits. And you really saw that it's a pay your way kind of thing. They had payment plans, obviously, because most people couldn't afford an amputation just flat out. Even back then, even when it wasn't as ridiculously as expensive as it is today, which we'll talk about later. So that's to give us kind of like our origin point here. And so, well, we reached a point in the economy of scale, right, where more people started seeing the opportunity to take the nonprofit business model of hospitals and make a for-profit model out of it. So right around the same time as these early reform efforts, right around the 1930s, 1940s, particularly right after World War II, a lot of these companies started finding that as more and more people became aware of the existence of healthcare, they were more willing to purchase it. Because it existed before this in different ways. It existed before this time frame, say like the 1940s, for example, and back. It existed before then in different forms, but it wasn't really something that was known about or that normal people could get. Right around this time, though, going from post-World War II into Cold War era America, this is when really the idea of everyone being able to get some kind of health insurance to help pay for their costs for healthcare, and it was all critical. It was all critical healthcare. Like you got into a car accident and you were, had to go to the emergency room, and again, amputation, something crazy back then, some major surgery that you had to go under for the 50s and 60s. That was the kind of stuff it covered. Not so much like, oh, your nose is running, let's use your deductible to go get a checkup, So this right here is really the government's first foray into pushing health insurance onto the consumer. 1954, tax deductibility of health insurance. So I say pushing. I mean, if anything, they're just incentivizing the idea of individuals getting healthcare, which I don't think is a bad thing. Like if we're going to have this tax system, which, we've talked about this before, but if we're going to have it, this is arguably the best way to incentivize people to get healthcare, is to say like, okay, well, we will steal less of your money if you go get healthcare. And cool. All right, fine. I think that's a cool trade-off, make yourself more fiscally responsible and medically responsible, and get to save some government cha-ching too. So 1964 right here, you have the Great Society, Medicare, Medicaid were developed. So the issue is that old people pretty much historically suck at saving money, and whenever old people get old, they have to go to the doctor a lot. And so health insurances at the time weren't going to cover old people, because old people get sick all the time and they like to die and go through really expensive procedures and break their hips and break their knees and all these things that health insurance providers don't want to deal with. So a part of that we'll get into, kind of over here, but this is really when Medicare and Medicaid being developed. Like Medicare obviously is for low income families, but Medicare is for elderly, and Medicaid is to subsidize Medicare essentially, if you want to look at it that way. But the biggest thing is that this system being put into place sets up everything onwards from this point to be able to say like, well, we already have Medicare and Medicaid. Why not just build off of that? Why not just continue to increase the amount of government involvement? See, over here, you have what is essentially a neutral, right? A neutral exchange. Like, yes, are they using their monopoly to incentivize a particular industry, sure, yeah, they're using their monopoly of force to be able to do this. But here they're using their monopoly of force to create. It's more than just incentivizing you to go in and get insurance. It's literally introducing the federal government into the marketplace. So 1970s pretty much more of the same. We're not going to really go into that. Regulation, anti-kickback statute. If you guys don't know what that is, I can post some links. I'm not going to go too much into that either. Not super relevant to today. Prospective payment systems, 1990s. Okay. So this right here is really what some people consider to be like the beginning of the end. I think really it's more like in the late 80s is really where you start to see this decline or this rapid increase in expenditures in healthcare. But the 1990s, and what does it mean, the rise of managed care? Well, the 1990s was the first time in American history where you were more likely to have health insurance through your employer than you were as an individual. It's kind of changed a little bit nowadays. It's kind of evened out, but in the 90s, that was the big thing, right? Was benefits. Because before that, really, everybody just kind of cared about their salary, right? But when the 90s came around, that was when the big push was made for like, okay, well, you may be getting paid $60,000, but do you have dental? Do you have eye care? Do you have, normal health insurance, whatever? And this is also right around the time when if you started to have a certain number of employees, you started to have to, you were required to offer benefits. They didn't have to be necessarily good benefits, but you were required to offer them in your business. So go a little bit further into the future. We have legislation on Medicare spending growth and failure of managed care provider integration. Basically means where we are today. Okay, this is now right here. So what can we get from this? We can get that from the very beginning, healthcare has always had issues. There has never been a time in American history where healthcare did everything everybody wanted it to do. So I'm going to let my dog out. When I told you guys at the beginning of all of this that I was looking for the time, the golden, the giant smiley face time before all of this, where healthcare was just great and you could go to your doctor's office and just, you pay $20 for you pay $20 for whatever, and you get your cold medicine, and it's all great, and you get the family doctor. Now that existed in this time period over here, somewhere in between like there and there, but there was never a time where American people were happy with their healthcare. Okay, there have always been a couple of factors, and it's if you're poor, old, or have a pre-existing condition. These, since the dawn of the healthcare industry, this has been it. If you're poor, old, or have a pre-existing condition, nobody wants to deal with you. And my dog is being super needy right now. I don't know why. But, and if you notice something, okay, whether you're talking about post-Civil War America or you're talking about 2020, what are the big things that everybody's talking about? If you're poor, if you're old, or if you have pre-existing conditions, healthcare. How do we provide healthcare for these people? I'm not going to go over this for very long. I just wanted to provide some more of this stuff. This kind of gives a little bit of context on what happened post World War II a little bit more. Okay, whatever. I don't care about all this, but insurance war plant factories, or insurance for war plant factories. Sorry. This is really like one of the first examples of implementing healthcare in a business and it benefiting both sides, because when the plants offered insurance, they were able to cover their employees when they inevitably got hurt working in the plants. So this, unions, Medicare, Medicaid, we already talked about that. Multinational companies, this is kind of what I was talking about when I was talking about, okay, well, you're this big, you need to provide this many benefits. I'm not too sure about that date, but okay. So you'll see this a lot if you do your own research. Reaganomics killed healthcare, right? You'll see this all the time. So it is true that Reagan deregulated pretty much everything when he was a president, for the most part. I mean, he did his Reagan things, but he did a pretty good job of deregulating a lot. And so whenever he did this, he opened up the way for for-profit services. He opened up the way for for-profit hospitals to really thrive in the 1980s. Before then, like I talked about, the first really experiments into for-profit hospitals were in the 40s and the 50s. But it wasn't really until the 80s that it kicked off. And now the standard today is the for-profit hospital. Before then, there were still more non-profit hospitals than for-profit hospitals, but they both existed before this. And then the 1990s is the first time that we really pushed for national. Well, actually, that's not even true. 1982, I believe, or 84, one of the two. 1982, we'll say, was the first time that a single-payer healthcare was ever pushed in Congress. It was the first time that a bill was proposed for single-payer healthcare. So it may seem like this is kind of a new topic to us, but really this has been in the House for the last, 38 years. It's been something that we've been talking about on and off, obviously, as politics changes, so do the topics of the time, but this is not by any means new. Single-payer healthcare is not, we got another dog here now, a brand new idea. And you know what? We already talked about all this, so we're going to go ahead and we're going to move on. One thing I didn't talk about, though, prescription drug reform right here. This is when Medicare started getting into the prescription drug business, because before then, Medicare beneficiaries did not get prescription drug coverage, and they provided these through tax breaks and subsidies. So that's definitely something. And obviously we have, which I don't really want to get into too much because I don't even think it's really relevant to the topic at hand, but we have the Patient Protection and Affordable Care Act, better known as Obamacare. But this was really, his goal was to ensure as many Americans as possible and to cover people with pre-existing conditions. Because like I said before, pre-existing conditions has always been a big issue for healthcare. So let's go ahead. So we already talked about we talked about the three issues for healthcare: poor people, elderly, pre-existing conditions. What do all three of those things have in common? Money. Money. Let's scroll down for just a second. If you're poor, you can't pay. Poor equals, we're going to do this as math, no money. Old equals not enough money to cover all of your expenses because you're going to be paying for a lot. And pre-existing conditions equals not enough money because you need a lot of money for pre-existing conditions and for old people. So there's the risk versus reward thing, sure, but either way, just to be able to maintain even just normal, like if everybody just got paid, if you put $2 in, you got $4 worth of healthcare, for example, you would still need to put in more money than a young person if you're old, or like a young healthy person than if you're old or have a pre-existing condition. So those are important things to keep in mind. And we're just going to kind of go over this real quick because, again, we're going to get really into the nitty gritty of like how to fix this. But these are all different graphs that all show the same thing. Okay, healthcare costs right here. They're going up. Healthcare costs going up. This one's by country. I think this one's pretty interesting. This is average healthcare spending per capita, U.S. on the very top. This one, I don't have to go through all of them. You guys can read or come back to this if you want. Healthcare prices increasing. This one, oh, well, would you look at that? Healthcare prices are going down, but that's actually not what this is saying. This is just how fast they're increasing. So, yes. So in 1970, healthcare was growing at nearly 8% per year, which is just absolutely insane. And it did spike from 2000 and really, we'll just say 2012 to 2014. We saw a big spike from essentially 0% to almost 6%. But it's only been zero twice in the last 50 years, actually. It's 2020 now, so 1970 was 50 years ago. Hope that makes you feel young. And so, okay, obviously, this is what everybody is talking about. Healthcare prices are increasing, okay? But we still have the same problem, right? If healthcare prices plateaued or increased with the rate of inflation, that's the most important thing here. This is, in my opinion, this is the best graph to exemplify what the issue is. This right here, this line is workers' earnings and overall inflation, okay, from 1999 to 2009. So we see a 38% increase in workers' earnings, a 28% increase in overall inflation, which actually is a pretty good number, by the way, but 131% right here. That's the real kicker, okay? So notice this graph starts in 1999, but if you're making things more expensive outside of the rate of inflation, you're just exasperating the issues that we had earlier, okay? And you're also doing a couple different things, okay? Old people have to save even more money now. So they got two of these arrows. Poor people, there's even more of them. We'll call them extra poor people. People with pre-existing conditions, it costs even more money to keep up with those pre-existing conditions. And health insurance companies want to make money. They don't want to have to spend even more money on your pre-existing condition because healthcare costs keep going through the roof, right? All right. So what are the potential options here? Okay, this is the number one most common. If you ask somebody what do we do with healthcare that isn't right wing, because they don't mostly know what they want to do with healthcare. If you ask pretty much anybody on the left, 9 out of 10 of them are going to tell you we need to go to single payer insurance, single payer healthcare, whatever you want to call it, universal healthcare, whatever way you shake it. Okay. And I found this from The Balance, which is a very pro single payer healthcare place, but I felt like this was actually a pretty fair synopsis of what's going on here. So the pros, okay, lowers healthcare costs for an economy. We'll get to this in a minute. That's pretty debatable. Maybe we'll put a question mark next to that. Forces hospitals and doctors to provide the same standard of care at low cost. Again, I agree with like this 100%. That's true. That's just the nature of government mandated healthcare. Eliminates administrative costs by eliminating the need to deal with private insurance. I don't like the word eliminated because you're just shifting administrative costs from the government from the private industry. Okay. And this isn't even getting into the ethics of implementing this. Okay. This is just me nitpicking what they're saying. Cons: forces healthy people to pay for other people's medical care. Okay. There's nothing wrong with that. Without financial incentive, people may not be as careful with their health. I never even considered that, but is it a valid criticism? I don't really know, but people don't really care about their health now while having to pay for it. So, by the way, the number one leading cause of medical bills or of medical expenses in the United States is obesity. Fun fact. Most universal health systems report long wait times. I mean, I'm not very informed on this particular issue, but I'm going to go ahead and take their word for it. There's nothing that jumps out at me as crazy. Okay. So I feel like, the pros, okay, whatever. We'll give them most of it. The cons, however, I feel like are pretty spot on. So the number one number you'll hear is from Bernie Sanders' 2016 campaign. He says $1.38 trillion. This is from Reason magazine. They did PolitiFact. This is from PolitiFact. They did an analysis of Bernie Sanders' $1.38 trillion healthcare plan. And funny enough, in 2016, this is the federal healthcare costs in 2016. Notice how just our existing healthcare structure, Medicare, Medicaid, all of this stuff right here, Medicare, blah, blah, Medicaid, these right here are 8 billion. Medicare under 65 is 80 billion by itself. It's 10%. 64 billion right here from Medicaid as well with ACA. Veterans healthcare, 63 billion. These are huge numbers that we're talking about here, but they also add up to this 1.38 trillion. And all of the people serviced in this group counts for less than 80 million people. I think it's actually this is right. Other way. This way. Less than 80 million people, okay? Right now we have, I'm going to spitball, I think it's like 335 million people, okay? So, and I know this isn't one-to-one how it works, okay? But let's just do some quick maths real quick and see what 335 divided by 80 is. I'm writing at a 45-degree angle. I don't know why. Sorry if you're reading this. I'm not going to do that because that's dumb, because I have a calculator. So we're not going to do long division because we're not in grade school anymore. 335 divided by 80 equals, that's a 4 times increase in the number of people serviced. Well, just 4 times. It's actually 4.1 times, but 4 times is fine. And for the exact same cost, okay? Now, again, I'm just being skeptical here. Maybe I don't understand the intricacies of how all of this works. But if you have a 4 times number of people to service, you would literally have to pay 25% on average the amount that you're currently paying for the same costs in healthcare. Okay? I'm just kind of scribbling right now. Now, if we go back for just a second and we talk about, or we look at the issues thing right here, right? Notice how this is from 1999 to 2009, 10-year period. That's a 131% increase, right? So we talked about that. And so over a decade, right, for an entire decade, not accounting for inflation offset, mind you. This is just pretending every decade is this bad. We have a 131% increase, right? Well, right here, right, we have a 400% increase in load, okay? So essentially, again, this is very rudimentary, but just to give you a mindset of what we're talking about here, that's roughly saying we got to go back and we've got to start paying for what healthcare costs 30 years ago, okay? Interestingly enough, 30 years ago is 1990. 1990 was really when we started getting into the introduction of private healthcare. I'm not saying that there's necessarily a correlation between these two things. However, I do think it's pretty interesting. Do I believe that this is a good solution? Also, the adjusted claim for like what think tanks have kind of like, oh, we can do it for like $2.3 trillion. that's, I mean, still not still not the 4 times increase we're looking at, but again, there is a lot of truth. This isn't a one-to-one thing. Really, more what I'm doing is giving you a thought experiment to kind of look at the volume of scale that we've got going on here. But saying that it's only going to be double, maybe that's fair over the 1.3. But I still think we should be trailing more towards that 4x than this 2x. If that's actually feasible, that's pretty amazing. But I just I have a hard time seeing it personally. So yeah. What are the options then? Okay. So if single payer healthcare isn't going to work because it's going to cost us too much money, like we can't even, I'm going to be honest, we can't balance a budget with universal healthcare in it. Not that we balance budgets anyways, but we can't protect ourselves from any sort of like cascading debt spiral, which means that they'll probably do it anyways because governments haven't cared about debt for the last 40 years, 50 actually. And so what are our options here? What can we do right now that's like a realistic option? Okay, so everybody's gonna hate me for saying this. I think did I put it here? I put it in the wrong section. Okay, what can we do right now? Deregulation. Now, in the interest of saving time, there's a couple of things I didn't talk about that go into this idea of deregulation. Okay? My dog is whining up a storm over there and is so distracting. So saying deregulation is fine. What specifically would you deregulate, Mr. Christian? I would deregulate, or I would allow health insurance to compete across state lines. Cross state lines. Trip, come on. Come here. Sorry, he's whining. Come on. You're gonna have to be out here then if you're gonna do that. Come on. Oh my gosh. You are so needy. Oh my gosh, he's the neediest dog ever, I swear. So, deregulate, or like I was saying, the first and easiest place is to deregulate healthcare across state lines. Okay? The next place that I would move on to is geez, man, my whole train of thought was just crashed. Thank you guys for sticking around, by the way. I know this can kind of seem like a little bit of a slog, especially through the beginning, but I hope you guys that are still here enjoying the knowledge that is that we're all sharing. Because I did a lot of learning when I was reviewing this as well. But yeah, so first things first, healthcare across state lines. What this does, right, before I move on, is it does this magical thing right here. So we get the fun, it increases competition. I don't even know if I spelt that right. Competition, whatever it is. And when you increase competition, you decrease prices. And our issue right now, not even now, the issue from time immemorial to now has been the price of healthcare. So if we can decrease the price of healthcare in some way, great. Another thing I would deregulate, standards of care. So everybody's probably thinking, standards of care? What do you mean standards of care? I want decent standards of care. Well, you're getting better than decent standards of care. So I'm talking about things, when I say standards of care, I say things like clinics must have X administrative staff. Did you know that was a part of qualifying as a medical care professional? Yeah, you have to be able to have an X administrative staff to be able to deal with a certain amount of people. Have you ever noticed how for every doctor there's 5 people doing files? I promise you, it's not because the doctor wants to hire 5 people to do all the filing. It's because they have to have a certain ratio of administrative to patients. So, other things you can do is decrease total coverage. And again, if you like where your health insurance is at, cool, great. You don't have to change a thing, all right? The clinics you go to, they might change some things. That might save them some costs. Your health insurance company may start changing things. Typically, if you sign a contract, though, you can get grandfathered into older plans. But if you start opening up these options for standards of care, these two being the biggest ones, in my opinion. And that's, so Gibbs here, he says, everyone gets amputated. That's not necessarily what standards of care means. Standards is like the government standards. It's like, is your building up to code? Not, is it going to withstand a hurricane? Is it up to the city's code, which could be anything. Like, your fence cannot be this tall. It doesn't have to necessarily do with, is it a functional building? It has to do with, doesn't mean our specific set of rules. So that's what I mean when I say the standards of care, not are you getting proper coverage? Because something that gets talked about all the time, it's like, well, if we deregulate, then malpractice will increase. And something that people need to realize is that if you sign an agreement with somebody that says, I will remove your tumor for X dollars. So tumor be gone equals $3,000 or 30. We'll just say whatever. We'll just make up a number. I think 3,000, 30,000 is actually probably not that ridiculous if it includes everything. Brain tumor too. We'll make it a brain tumor. We'll make it a big deal. Brain tumor be gone for $30,000. Okay. And if in your contract it says like you won't die or all of these different things, your contract, if you're signing an appropriate contract, will protect you from malpractice. Okay? And also, if you make an agreement that says you're going to fix me and then they don't fix you, then they are violating their contract and you have recourse. Okay? So any situation where government exists to protect you from malpractice, the NAP already does that. That is the weirdest T ever. These letters are so gross. I hate them. Cool. All right. So these are things that I think are actually realistic. Like, we could do this tomorrow. And these are things that could make healthcare cheaper. These are things that could definitely see an impact. And so, there's other things as well. So we could literally do this all day. I could start talking about pharmaceuticals. I haven't really even talked about drugs at all, which pharmaceuticals, we have an issue of lobbying, which is an issue of government influence. If government goes down as far as their influence in an industry, so if government is less in an industry, lobbying is automatically weaker. Okay? So that's something important to notice, is that you don't... The easiest way to curb lobbying is to curb these guys. And the easiest way to curb those guys is right here. Deregulation. Cool. All right. And what's the perfect scenario? In an ideal world, what is the perfect scenario? Okay. Let me just write this out real quick. Okay, so we got this word here. It's called government. And then I'm gonna take it, right? And I'm gonna draw this around it, right? And then I'm going to hit the delete key. So if the practical solutions are to just roll back what we have existingly, what is the perfect scenario? The perfect scenario is that you don't just kind of roll it back. You don't just kind of edge it back. You nix it all together, right? You say, be gone regulations. And I know this kind of seems like a cop-out, right? And I even put this guy here, deregulation. But when you have an issue, how about I put it this way? This is even better. If government gets in the way of you getting to the market, or not marquee, the market, if these two, if there's a wall here, right, and it keeps you from the market, this is government, right? Your best option every single time is to get yourself over that wall, under that wall, through that wall, whatever it be. Deregulation every single time. A menu and fees of hourly rates from doctors when you walk in the door. Yeah. So what happens is, so you'll get these things where, let's say, for example, transparency legislation passed in like the 90s or whatever, right? And so what they did is to comply with, yes, well, actually, that's true, Gibbs. We shouldn't build a wall, but that's another topic for another day. What happens is that whenever they put out this initial wave of quote unquote transparency laws, and whenever they did this, they inadvertently created what they have today, which is, oh, okay, so you go in for stitches, right? And then you pay $10 for the gauze, and then you pay $20 for the Band-Aid, and then you pay $40 for the chair, and you pay 120 hours for the 20 minutes it took them, and then you pay $60 for processing fees, and another $5.99 for shipping and handling, and then you renew your Amazon Prime subscription. What's that, like $100? I think it's like $99. And, you know, it all adds up. And then the next thing you know, you're paying $1.38 trillion for your stitches, right? And so they put up this like wall of paperwork in the name of transparency. It's like, well, I'm supposed to be transparent with where all this money is going. So now you can just blatantly see that it's going to all of these different things, and that I apparently am worth $340 an hour, and you know, all of these things that you don't get told. Let me ask you this. Let me be slightly not boisterous, but let me be slightly blunt here. When is the last time you walked into a doctor's office and it was like advertised to you, like you went into the dermatologist, you know, you went to the derma, let's say you're going to the dermatologist, and you go there and you can just ask them, like you could say like, hey, if you have whatever, folliculitis, which is like whatever, I'm not even going to spell it, folliculitis, Fally, you have Fally, and they can tell you it costs X immediately. They're like, oh, well, if you have that, we're going to prescribe this, it's this, right? What you're going to get now is that you're going to get, okay, well, if I have folliculitis, how much is it going to cost? It's like, well, it's going to cost this much to get the test done. Yeah, and then it's going to cost this much to get the biopsy done. And then it's going to cost this much for this. And it's going to cost, we got to do this for the stitches. And it's going to cost, the prescription might be this. It could also be this. And you have this nightmare. And a lot of that barrier, especially from the clinician's side, you know, health insurance is a tangled web that requires more than just deregulation. It really does. It requires an adjustment of how healthcare is approached. But you know, from the clinician side, a lot of this stuff is kind of forced onto them. Okay? Like your dermatologist does not want, if you come in and say, I have folliculitis, you know, and then they say, okay, well, I'm a doctor. Let me look at it. Okay, you say it's folliculitis. It kind of looks like it. I'll take your word for it. You're an adult. Sign here. Here's your prescription for your folliculitis cream. And it doesn't fix it. Then they have to worry about, is this person going to come back and say that I, through the very vague term that is malpractice, didn't uphold my agreement to fix this issue? Okay? So what they'll do is that's how you end up going through this route. It's like, oh, we got to get a biopsy, we got to get the tests, and then come back in 2 weeks, and blah blah blah. Even if it works, we still need you to come back so I can look at it. That's how you get into this. And Gibbs here says, they don't give you an estimate like you do for a car repair. The bill is a surprise. Yeah, imagine that's a great example. So imagine if you came in, and forget this whole dermatologist example. That was just the most recent time I've been to a doctor's office. But let's say you go and you take your car to the shop, and then you say, how much is it gonna cost to fix my my blown tranny? That's an LLN reference. And then they say, oh, well, it's gonna cost this money. But instead they say, oh, it's gonna, well, we gotta run a test, and then we gotta wait for the results, and then we gotta do some processing fees, and we don't know. Would you take your car there? Would you? I mean, seriously, would you take your car there? If you got the guy who says like, it's gonna cost between this and it's gonna cost between that and $1.50, or whatever. Cool. Okay. All right. Sure. Whatever. This guy's got some kind of ballpark, and this guy's like, I don't know. We got to do more tests, and you got to pay me for all of them first. Yeah, exactly. And Derek here puts it pretty well too. It's signed to a magic insurance fairy, and we I didn't even really talk about that, but when insurance, we went through the history of it, and since we're kind of at the end here, I'll kind of go ahead and I'll backtrack, and we'll use this open space here, or we can go to the timeline where we were earlier. It doesn't really matter that much, but really, right when I was talking about in all these doodles, the introduction of the standardized business healthcare in the 90s. That's really we'll go to this one. That's really when insurance became the magic fairy. And so it went from you to your doctor, and then cool, you're good. This is how healthcare was for like, I don't know, 10,000 years. Okay? From the days of the witch doctor, or not money's years. From the days of the witch doctor to post Civil War era, this is how healthcare worked. Okay, you might have other people sponsor it, but either way, it was a 1-to-1 transaction. It's just right here. There's nothing else going on. Okay, when insurance was put in, right? This right here, this can be a little daunting because you may not always have that much money on you. Okay, but what if you had a savings account that is just put aside for health insurance, and it's literally just there to cover you, but you don't have to save all of the money up. We'll front you because we know you're going to keep paying, right? So we're just going to go ahead and pay for you, and then you'll just continue paying on it, right? That's the model of health insurance, right? Health insurance works as a business model best when nobody uses it, right? That's how you make the most money. So then it became you, and then access to a big pile of money in the ether to your doctor, right? But these people want to keep this big pile of money as big as they can. So then when you start having prices for, inflation, actually, just screw inflation, like look, these guys looking out for their profit margins. Okay. Let's, even things like inflation, right? Or even maybe like your wages, you suddenly your wages decrease, right? This guy's still got to get paid at the end of the day. And if you stop negotiating for yourself and you start saying like, well, I'm putting, let's say this is the 50s, I'm putting $20 a month into this health insurance plan. It's probably less than that because it was all critical care back then. To give me access to this big pile of money if I ever get hurt. Well, for your doctor to get access to that big pile of money, which you don't have, because remember, you're broke. You ain't got no money. What are you talking about? You're poor. For your doctor to get access to that big pile of money, they pretty much have to accept whatever these guys want. And so in one fell swoop, they gained all of the negotiating power because it's not just you. It's like you times, like a million. We'll just say that, okay? We'll say this is like the 60s. A million people are covered with private health insurance, or 50s is probably more realistic for that. Something around there. Million people covered in private health insurance, right? For your doctor to get access to a million people, they got to do what this guy says, okay? At least if they're going to take their money, and they want their money because they want your money, right? And once health insurance companies realized, like, whoa. So you're telling me we have all of the power in this situation? Not only you got access to a smaller pile of money, because remember, they want to keep their money. So you get like, instead of 3 monies, you get like 1.5 monies. And your doctor gets pushed another step away, right? So now your doctor doesn't just have to do this. It also has to go through, your doctor has to go through their own price scaling is what it's known as. And price scaling is basically where the insurance company did what the old negotiation thing, like, okay, well, you can't charge X if you're going to take our money. Well, now it is such a tangled web that people who sign onto these agreements don't even always know what they're signing on to. And I wish this thing would just erase. So yeah, that's just getting into the insurance side of it. Really, the biggest thing to fix all of this, how do you fix all of this right here? What's the easiest way to fix this? Increase competition. You increase competition, you decrease prices. Right? And the doctors, right? Doctors can only take so much, right? So will the doctors at first probably be, attempted to get screwed to make up some of this cost for the increase in competition? Sure. But it reaches an equilibrium eventually, okay? These things take time. So I only has 1.5 monies exactly. So that's where we're at with healthcare anyways. The easiest way to fix this is to increase competition and decrease prices. And how do you do that? Boom. Regulation. Or deregulation. Let's go ahead and highlight that, people. Deregulation. It's D because it's German. So it's the magical solution. Magical solution. So the next time someone says, oh my gosh. Now, okay, so I think there's some pretty valid criticisms to this, right? So it's like, what about the poors? Okay. What about poor people? You can't, I'm sorry, you cannot make healthcare cheap enough, right? There's not enough deregulation we can do to bring down the big money cost of, say, a kidney transplant enough that someone who's below the poverty line can afford it, okay? It's not going to happen. So this is where I want to bring up a couple of good examples of people who didn't rely on health insurance. Her name is Mary Seacole. And this is going to be your extracurricular reading. If you are curious, really, if this is something that really concerns you, which I think is a valid concern for a lot of people, I'm not going to spend a lot of time talking about her. There's a really good video series on Mary Seacole I would recommend from a channel called Extra Credits. They do a series called Extra History. They talk about her there. And basically, the long and the short of it is that she provided healthcare to people who couldn't afford it by charging slightly more for the people who definitely could afford it, right? And so, every company has the right to set prices for whoever, by whatever they want. If you don't like somebody, you can increase the price of something on them. Now, you can't do that now, necessarily. You can, but you can't just, do that. But you can't say, like, you're rich, you must pay more for my thing. But if deregulation, again, that magic phrase, were to be implemented, then you don't even have to really say, like, I'm charging you more because I'm going to help the poor people. Or you can. That's a great advertising platform. But, yeah. So I don't know if anybody was expecting, like, some kind of magic revolutionary idea on how to fix healthcare. Really, I mean, I'm not an expert on this topic, so I don't know what you were expecting, but I feel like I did a pretty good job of talking about what's wrong with healthcare, what is the actual problem, and what are some ways that we could fix it. Obviously, I'm going to say that any solution that involves using the government, it's technically feasible. Like it's something that you can do, and this is gonna get turned into like a clip or something of me saying that the government is technically okay, but ethically speaking, that magical word I talked about all the way in the beginning of this, if you're going to be using government to help people, government right here equals violence, and that's not what we're here to talk about today. And maybe if you guys want in the future, we can go into a big, long discussion about why government equals violence. We can do that. Well, now you can, if you're recording it now, it's fine because I put government equals violence. And so we're good. The anarchists won't kill me. I mean, I'm one of them, but you know, if they just saw government equals technically okay, then yeah. But so could you implement single payer healthcare and it work? Would single payer healthcare work? Sure. Sure, it could work if you're okay with the violence. We'll just say theft because I don't want to write out violence. Single payer healthcare could work if you're okay with theft because, as we all know, and we're going to end this whole discussion on, taxation is theft. And we're going to do it all in different colors. Dude, why are my E's? That's not how you spell theft. Taxation is theft. I'm going to have to do so much editing for the podcast of this. That was my biggest worry. But I think this looks pretty good for a YouTube video. Time. Okay, an hour and 10 minutes. Cool. Actually, it's like an hour straight, basically. Man. All right. Well, that was something. Oh, I dropped my pen. Give me a second. What the heck? It's gone. I was gonna draw a heart. Okay, I'll have to click draw it. Heart. That's what you guys get for sticking around for this whole thing. So cool. I think that's pretty much all I've got for this episode, man. I I condensed down 2 weeks of reading and researching and thinking and writing into an hour long spiel on telling everybody what they already know. I guess if you ever wanted an easy to digest hour-long lesson just verifying what you already know, you came to the right place. I cannot say that anything I talked about today is some original idea of my own. Only that I said we'd talk about healthcare. So we talked about healthcare, and yeah. So what'd you guys think? Was this fun? Should we do more stuff like this in the future? I know we started at like 8 people, and we're at like 4 now. So I don't know if that's a good sign or not. I don't really know. That was fun. I loved all the visuals. I figured somebody out there would appreciate the visuals. Taxation is theft. Yeah. So yeah, that's really, yeah, I think it was fun. Um, this was honestly a last minute addition. This whole visuals thing, I was not gonna do this at first, but then I was like, man, let's not make this boring as hell topic even more boring. So so this is the method I decided to go about doing that. And I think it's, imagine if we had done this exact same thing, but instead of having all the fun visuals, I just sat in front of the camera and said the exact same thing. Gross. Uber mega gross. Not gonna lie. Not gonna lie. Oh man. But yeah, honestly, I think I said more words in this episode than I do in most. I feel like my throat's all like, "Hey, dude, you need to calm down, man. You're going a little overkill over here." Here, I'll go ahead and I'm gonna close that. Boom. I'm all big now, biginated. Yeah. Well, yeah, I think that's all I've got. You guys have your homework. Do some reading on Mary C. Cole. So that's gonna be the big thing. I will post. It's not gonna be tonight. I'm tired. I want to play some video games and go to bed. But I'm gonna post probably tomorrow a bunch of links from all of the, not all of them, but a lot of the sources that I used whenever I was researching this topic, so you guys can do some reading. I'm gonna start doing that every time we have any of these episodes where we talk like about a particular topic. So I really liked having the resources there for the episode we did on Iran, and we'll definitely have to do some more of that in the future. I can't promise that every episode is going to be like this. Like I needed time to prepare for this, and I don't always have that. But when it's possible and when it makes sense, we're gonna do this format. We're gonna do, or we'll try to implement it more. Maybe once or twice a month we'll have a lad 101 episode instead of a a normal monologue episode. And I do want to try to get some interviews on again. So if I could do like one or two lad 101s, one or two um, normal episodes, and one or two interviews a month, I think that'd be pretty cool. But yeah, okay. Now I'm just kind of ranting about the show. So that is all I have for you guys. Another awesome episode is on the books. Thank you, one and all, for coming out to Liberty After Dark. If you guys enjoyed the show, make sure you give us a like on Facebook. We just broke 200 likes the other day. That's pretty cool. Join the community group. That's how you're going to stay up to date on polls that led to the creation of the episodes like this. And then make sure you check out the Patreon. We have a Patreon at libertyafterdark.com or patreon.com/libertyafterdark. Sorry, I suck at this. We also have an email at contact@libertyafterdark.net where you can shoot us any emails. We're still doing submissions if anybody wants to send some of things you've done in your neighborhood or your community to promote liberty. I don't care what it is, big or small. We'll at least give it a mention on the show. So again, contact@libertyafterdark.net for that. Does anybody in the chat have any last things before we go? We'll give you like 10 seconds to type out a character that lets me know I'm waiting. Other than that, I'm just going to kind of sit here and ramble into the microphone for a few seconds before I just go ahead and split. And it looks like we're good. Awesome. Okay, cool. Thanks again for everybody coming out. I enjoyed this. Good stuff. Good stuff. I have no idea how I'm going to make this into a podcast. I might not, honestly. Maybe this one will be video only. So yeah, cool. We'll see. Y'all take it easy. Oh, expect YouTube stuff in the future. I'm working on it. Bye.